And now, without further ado, coming to our session for today, Dr. David Lim, who's a special care dentist. Dr. Lim is a dentist by profession and treats persons with special needs. He understands that achieving oral health can be difficult for persons with disabilities. He bears witness to the chronic nature of dental diseases and innately feels the importance of early prevention. He believes that with improved knowledge, skills, and outlook, healthcare workers and caregivers can make an impeccable improvement to the oral and general health of their dependents. And this webinar is an endeavor in the same direction, along with Ability's contribution. We are so very happy and excited to have you here with us, Dr. David. Thank you so much for joining us today.
Thank you, Swati, for the kind introduction. I hope all of you are having a good evening or afternoon, wherever you are from. All right. So, Swati, is that the sign for me to start sharing?
Yes, I was about to request you to please get started. The attendees are really eager to hear from you.
All right. And here we go. All right. First and foremost, I'd like to thank Lily and Swati for organizing this webinar and inviting me over to share. In my line of work, I see people with special needs across the age spectrum from 3 years old to 80 years old. So as I look at the teeth over the age, there's a lot of things that goes through my mind, of course, and coming out to advocate and to let everybody know, everybody who is working with people with special needs, to really look into this. If you think of COVID, there hasn't been any vaccine for before the last year. However, today we have found multiple vaccines, many ways to deal with the disease. For dental disease, if you think about it, treatment and prevention, it has already been around in the world, knowledge of how to treat it for at least half a decade. However, dental diseases is still prevalent, especially in persons with disabilities. And we can see that the severity in special needs children are much more severe. So whenever we talk about this as healthcare professionals, there's always this question of equity. How can we make health outcomes equal for all children, and particularly children with special needs? And you can see why it's especially important later on. And so that's me. This is my name. I'm David. Okay, what shall we cover today? Why is oral health so important? Okay, the second part, what challenges do children with special needs face when they seek dental treatment? Okay. So it's not just dental treatment. Your daily cleaning, many children with special needs also face difficulties. What preventive habits? When we talk about prevention, it's oral health prevention. So preventing the disease, preventing even its onset. Okay, so we don't have to go into the part where we have to start doing extensive treatment. So this is really important, and there are a few ways that we can look at it. Of course, the ideal situation for your child, for your dependent, whoever it is, will differ because every individual faces different problems. When we talk about special needs children, it's a very, very wide spectrum of different needs. Some may need more of this, some may have more medical needs, some need more behavioral assurance and stuff like that. So often we have to personalize and cater things. So the first learning objective, the importance of oral health. Even before we go into the importance of oral health, I would like to, I hope that everybody is on the same page that there are two main kinds of dental diseases. So this is your gum disease and tooth decay. So by the way, WHO sees both of these diseases as global pandemics. Okay, although you may not believe it, but there are really many people with tooth decay and gum disease out there. So what are some of the characteristics? So on top, gum disease, these are some of my special needs patients. They are adult teeth. So as you can see, on top, when you have gum disease, often the gums are red and sore. Sometimes it's bleeding. And you have these hard deposits called tartar. So tartar forms when soft deposits stick on the teeth, they harden, and they are very hard to brush off. They gather bacteria and they start to cause gum inflammation. All right. Sometimes as gum disease progress, it will cause teeth to migrate. That means the teeth will shift apart, like for this patient. And on the long run, the tooth will become shaky, drop off. Sometimes there can be pain. But by and large, gum disease don't manifest pain very early on. And for tooth decay, it starts off with decayed holes at the back. I hope you can see my little annotation with the red lines. And as it progresses, the whole tooth may fracture off, may crumble, like an apple being cored out from the center. And what you are left with is roots, what we call root stumps, or roots for short. So this is another one of my patients, really swollen gums. So this shows this gums grows oversized due to poor brushing. As you can see, the gums on the right side, pretty good, pretty okay, not perfect, but I'm quite happy with this. However, as you can see on the left side, it's really red, angry, swollen, it's bleeding on the inside. You see these dark areas here. So this patient of mine, he doesn't brush so well on the left side. And it's hard to get him to do it on the other side. He has poor manual dexterity because of intellectual disability and because of the poor oral hygiene plus his anti-seizures medication. So anti-seizures medication is known to sometimes cause gums to grow oversized. Okay, so we try to tackle the dental disease first by doing a thorough round of cleaning. So of course it improved after one round of gum treatment, and we let him come back in 3 months' time. However, there was a strong relapse of the gum disease in 3 months' time. Why is this so? We did a really good round of cleaning and it doesn't seem to improve. As you can see, there are certain soft and hard deposits, and the gums are swelling over here again. Well, that's because his oral hygiene hasn't improved. So no matter what good magical dental treatment we can do in the office for your child or for your ward or your student or your dependent, the key thing is when they go home, what happens? Okay, so although we dentists like to think ourselves as, well, the heroes of the day, but really the heroes of the day are the caregivers, okay? So we are supposed to support your needs, and I hope that drives the message through that you are really important. Okay, oral health and well-being. So having good, healthy teeth will contribute to good well-being, good health, good quality of life, just as every other health aspect, your mental health, physical health, emotional health, okay, your social health also, it all contributes to a person's well-being. And that's not different for children with special needs. And over the years, as research start to look into oral health, this small little part of your body, however, it can give rise to so many physical issues. So when you have, let's say, tooth infection, gum disease, the bacteria in the teeth sorts of bypass into your bloodstream, and it causes a whole mayhem within your whole body. So it starts off with high blood pressure because your body mounts an immune inflammatory response to all this bacteria. So it causes high blood pressure, and after that you start to have cardiovascular disease. The inflammatory response also worsen your blood sugar control, hence you get diabetes, and it increases the likelihood that your blood clots. So you also are at risk of having stroke. Some of this inflammatory response also give rise to increase the risk of Alzheimer's dementia. If your oral bacteria drops into your lung, especially for people with swallowing disorders, those with cerebral palsy, for example, there's a high risk of lung infection. And when you lose teeth, it affects the ability for your mouth to breathe properly when you sleep, and you get sleep apnea, and of course malnutrition, and the whole list goes on. So oral health really can hit anywhere. Okay, and if we think about it, high blood pressure, diabetes, high cholesterol, we won't want our children or our students to get it, especially at a young age. However, for oral diseases, will you want your child to also suffer from a chronic disease? So I believe not. However, the difficulty here that all of us face as caregivers, healthcare professionals, dentists, oral health therapists, there's many folds. Because children with special needs face much more challenges as compared to our typical children. Okay, so some challenges in oral care. So like we've seen just now in the previous patient, certain medications, not just anti-epileptics, they can cause overgrown gums, and this sort of shifts the teeth away from one another. As you can see from this photo, there's swelling of the gums here. It's really difficult for you to brush underneath. Sometimes it bleeds, it's painful. Okay, the next point, hypersensitive mouth. Okay, I'd like all of you to take a moment and imagine this. If I place a finger on your skin at the back of your hand, will you feel very sensitive? Not really, right? I mean, you know there's a finger there, there's some sensation. However, if I raise your hand and expose your armpit and I stick my finger there, will you feel sensitive? I think most of you will say yes. So that's what happened for some children with special needs. They have certain regions in their body that's hypersensitive, especially for those with autism spectrum disorder. The way they perceive sensory information is quite different. So there is quite a key need to desensitize and get them used to this. And at the same time, we need to try to identify what's the reason for some of them not wanting to receive the usual toothbrushing. On the other hand, we have the other spectrum, hyposensitive mouth. That means the mouth is less sensitive than typical people. So, for example, sometime back, I saw a patient, he has some vegetables stuck between his the last two molars. So I asked him, I see that you have had vegetables in the morning. Wow, that's great that you are doing that, eating fiber in the morning. However, the caregiver said actually he didn't eat vegetables. In fact, the last time he ate vegetable was like 2 days ago, where he had this and that. So the thing is, some of our patients, there's something stuck between the teeth, or maybe it's a bit painful, but they don't really think about it, and they just leave it there. So when you have all this food stuck and you don't get it out, sometimes it causes the dental disease. Okay, so that's another end of the spectrum. Poor manual dexterity. And by and large, how do we assess manual dexterity? If somebody can write well and fairly neat, you can see the handwriting is fairly well, then I would say they can do toothbrushing themselves. However, if they are holding pens like this and trying to draw, then we may question whether they have enough manual dexterity to do toothbrushing. So that's one way for many of you to assess whether this child needs extra assistance for brushing. By and large, I would encourage all of you to do toothbrushing for the child also. Okay, it's also good bonding time together. This part, communication. When it's pain, they may not say, or they can keep scratching their face because it doesn't feel comfortable, and they can cause self-inflicted injuries. And I've seen people with special needs chewing through their cheeks, and there's a gaping hole on the side here. So that's quite a poor thing. However, not every single person with special needs is the same. So sometimes we can just do dentistry pretty normally, like the one on the left side, or you need multiple assistants and family members to coax and to support, give positive reinforcement for dentistry to be done. So it varies a little. So I'd like to share a little case to let all of you understand. nowadays we talk about life course approach for special needs children, because we want to see them up till teenage, young adult, adulthood, and old age. So this is some of the older special needs adults that I tend to see, because they can be pretty complex. Okay, so Mr. J, he's an adult with moderate intellectual disability. He has not been out of the house for over 10 years. Hasn't been, in the past, we don't really have very good special needs schools. And I think that contributes to part of the problem, because if they have not seen the world, they have not met different people, they have not seen other healthcare professionals, then you try to bring them to a dental clinic and it's impossible. And of course, you have other issues, weight loss. Okay, so there's many things to think about. Mr. J needs extensive gum treatment. So is he able to tolerate it? Do we need to give him some drug to do the dentistry, or can we try to manage the behavior through non-pharmacological techniques? In addition, he has not seen doctors before for many years. So is there something else to it? As you can see, he has some features of Williams syndrome, but it was never diagnosed. So there's sometimes cardiac issues associated with it. And as dentists, we would like to know if there's cardiac issues. So even after we do all the dental treatment, is the family able to support his toothbrushing? Because he's over 60 and mom is very, very frail, 85 and above, and his siblings don't really stay with him. So there's a whole lot of things. That's why I think Ability as a network really sets children with special needs up for a better life, better quality of life. And I really thank them, and I've seen their effort grow. So, okay, back to my story. So as you can see, various features of Williams syndrome, broad nose, sharp ears, twisting of the little fingers, and a lot of hard deposits around the ears because of years of not having a good dental care. Okay, so we decided to see him in his house, and for that to happen, we really packed a lot of things over here, oxygen, and we have to get quite a few strong person to bring the things along with me. And of course, as we go along, we found that this method helped him a lot. And this is me doing some, giving him an injection to numb up the area. So we have sedated him. And during that period of sedation, we also got an optometrist to come in to check his teeth, because it's aging. We want to make sure that his sight is okay. Otherwise, he's falling over things. So as you can see, there's multidisciplinary collaboration as we work for people with special needs too. So this slide is a little technical, but by and large, as you can see, this was before treatment and this was after treatment. It took very, very long to reach this stage because the main thing that we needed to address was to prevent his oral disease. That means we need to ensure he's brushing, his diet, and everything is good. Okay, so this is the key part. If you have not been really paying too much attention to my blabbering, this is the key part that you all have to take in, the 6F of oral prevention. The first thing is food and drinks. Okay, we have to look at what we feed our children and our dependents. Okay, to do your daily brushing. Okay, flossing, you don't have to floss for children usually, unless their teeth are really tight or if your dentist says so. Okay, fluoride helps to prevent dental decay. Frequent follow-up. So try to see the teeth before it becomes too severe. Dental diseases tend not to be painful until when it's at the most severe stage. So it will be treatable until the end where it starts to become painful, and that's when the tooth might need to come out. Okay, fissure sealant is a technique. It's like a type of filling. You put a flubber filling to cover up the teeth. And of course, family and community. It contributes to our oral health knowledge. It tells you where are the dentists that you can find to help their children with special needs. And they will refer you ways to manage the dental issues that you face. So food and fluids, I think all of us would be familiar. So by and large, avoid sugary and food that's too sweet. It's okay to give a snack or reward once in a while, but generally reduce the frequency of snacking. So if you're having breakfast and you have 2-3 snacks before lunch, it's as if you have not let the teeth rest before lunchtime. So if you want, you can provide snack just after your breakfast, after your meals. Okay, so after your breakfast, after your lunch, or after your dinner, but in between, try to extend the period so it allows the saliva to replenish the teeth with minerals. Okay, so there's a little bit of healing process that we want to optimize it. Okay, of course, more fruits and vegetables. Fibrous fruits after a meal tend to brush off some of the plaque, so that's a good way to do. Think about it too. Plain water and unsweetened beverages. Okay, so xylitol gums and sweets can help because xylitol is it reduces the action of the oral bacteria. Okay, the next one, brushing and flossing. Your technique and the frequency of brushing is really important. So brush at least twice a day with toothpaste, with a fluoridated toothpaste. The technique, you can use any technique as long as you cover all surfaces of the teeth, of all teeth in the mouth. The duration also, 3 to 5 minutes each. Okay, you don't have to brush too hard, but at least gently and cover all the surfaces evenly. By and large, try to brush 30 minutes after meals and snacks. This is to, after a meal, your teeth soften slightly, and this 30 minutes allows the teeth to replenish its hardness. Okay, so for people with poorer manual dexterity, I would recommend this 3-phase toothbrush. So it's called surround toothbrush. There are various nice colors. These colors are made to suit persons with autism spectrum disorder. So it's nice and padded, and there's a long handle, so it's easier to grip. Okay, I'll pass you all the contact, especially for the international audience. So for assisted toothbrushing, the positioning is key. So if your child is sitting down, you may want to stand behind like this, like over this. And you use your abs to block the backward movement of the head so you can brush and try to go around all the surfaces. I encourage the receiver to hold a mirror up so to get him or her engaged in the activity. If the person is on a wheelchair or lying down, I would come from the face front. Okay, the key is to have a head rest around here or around here. And this is one of my colleagues who is a oral health therapist doing it. She's from Taiwan. So as you can see, she comes in from the front so she can have a full visual view of this. The third F, fluoride. Okay, fluoride is a naturally occurring ion, a mineral. So it occurs naturally in food, tea, and certain mineral water. It enters the tooth surface, creates a very thin layer and strengthens it against decay. So prevents and stops decay, it reduces the effect of the acid and reduces sensitivity, various different types of actions. So it's present in your tap water. Most countries have fluoridated tap water. Okay, it has been shown to reduce decay, the risk of decay in children in many countries. Of course, it's present in certain types of toothpaste, okay, mouthwash, filling materials, and if you do fluoride therapy, of course, there will be fluoride inside. Okay, one of the toothpaste that I like to use is Oral 7. So it's a very mild toothpaste. The taste is not too stark, and for my patients with hypersensitive mouth, this works really well. It moisturizes, it doesn't foam too much, so it's helpful for those with swallowing disorders. There's not too much foam and it doesn't dribble into the bronchus. And yep, it's fluoridated too. So there's various other types of fluoride in a huge range of products. All right. The fourth F, Okay, let's treat the disease before it becomes severe. So your dentist should be able to tell and indicate where are the growing decay. So if it's very, very mild initial stage, it hasn't formed a hole yet, it is reversible. However, once there is even a very, very small sesame seed size of hole, no, it's not reversible anymore. Okay, and you have to do a filling to cover that up. It's also to follow up with changes in medical history. Sometimes because of managing behaviors, or if your child enters adolescent and because of puberty, there's changes in behavior and they need additional medications to calm them down, mood stabilizing. Sometimes this changes the saliva quality and affects your oral health too. So by letting your dentist know all this, they can see if you need to make any additional changes to top up that daily oral care, the routine oral care that you do at home. Maybe you need to brush at additional time, or really, really cut down on any form of sweet food. So discuss this with your dentist. Usually it's a 6-monthly review, but it can be 3-monthly. And I have special needs patients that come back to me 1 monthly, because at home, a single parent is very, very hard to hold him or her down to do the brushing very well. So when they come into the office, we do it a really good round and we try to see him, and that works well. Okay. The 5th F. So you have to get this done at the dentist. It's called a fissure sealant. So on the back teeth, the molars, there's small little pits and fissures, and this tends to trap food, sticky food inside, and over time they can start to become a decay. So prevention first. So dentists, many, especially kids dentists, they like to go in and seal up these grooves, make sure they are fine, and you don't have to worry about it later on. So it's an easy to do flowable filling that seals the grooves, and as compared to a conventional filling where you have to do drilling, usually this doesn't need too much drilling. You can just clean it with a little brush and you can flow it, and as you can see, it really reduces the valleys, the depth of the valleys, and it helps to prevent dental decay. Okay, the last F. Okay, family and network. Okay, if you look at the whole life course approach to oral health, we tend to look at old people on what works best in terms of how oral health contributes to their health. So if you look at people who are over 100 years old, like those in Okinawa or various blue zones in the world, blue zones are places where there are very, very aged people. And how does this relate to our children's oral health? You'll notice that people who age very well have a lot of teeth, and most of these people who are over 100, they have almost a full set of teeth, and that is amazing. So we don't know the exact link, what causes these people who retain their teeth to live so long. It could be the nutrition, it could be additional stimulation, neural stimulation when you eat, and so on and so forth. But this link has been found. And how do these people keep up with good oral hygiene through this 100 years? It's found through their family and community practices. That means good diet. They brush their teeth very well, especially in Japan, where they enforce very good brushing all from a very young age. And hence in Japan, you have many old people who are very well aged and they have still a very good set of teeth. And I hope that while we are seeing children here, they have a fruitful and healthy life. And oral health is one thing that I feel really affects their health as they age. Okay, good practices start young. And last but not least, our network. Ability is our network. And through this platform, we advocate state-of-the-art education practices, health practices, and also through here, I'm advocating for good oral health in children with special needs. And with that, before I end off, I'd like to have a summary page. So if all of you like, you can do a screenshot, or we'll prepare this into the notes or the material. All right. So I'm going to leave it here. So Swati, I'm passing the mic back to you.
Thank you, Dr. David. That was really informative. Before I move to the next segment of our session, which is Q&A, the chat box is filled with too many questions that people would like to ask from you. We would see if we are able to take and cover most of them. I would like to also inform our attendees that if they wish to register for the next workshop from Miss Rita from US, the next workshop on 2nd of September would be a part of the certificate training program and would be the first workshop under module 1, which is child development. If you wish to register for it, please find the link in the chat box and you can register for the workshop right away. Okay, so now let's get started with the questions. The first question, which has been most commonly asked by not just Shabina, but so many others, is what can be done in particular for bad mouth odor, especially in children from the smaller age group, like 3 years?
Okay, thank you for your question. So I think bad mouth odor is a problem that many parents have reflected to me also. It can be bad mouth odor or halitosis can be due to many issues. It could be the food they take. So if you are having a lot of fermentable foods like cheese, it can cause some odor. It can also be caused by debris that stuck in the teeth and they start to ferment and they release certain types of gases. It can also be caused by medications. So certain medications cause a certain taste and odor. But if you're on medication, I suggest that not to stop it. If you want to stop any medications, please check with the doctor first. Gum disease, especially the severe ones or the where you have pus, that also contributes to the bad mouth odor. So generally, what I would suggest is for all of us to have really good oral hygiene. Just check through the mouth. If brushing twice a day may not work too well for you, you may want to brush 3 times a day. Having less sugary foods, like sweet drinks, also looking at your diet also helps to reduce the bad odor. Sometimes with bad odor, people try to use mouthwash to mask the odor, but it doesn't deal with the crux of the problem or the basis of the bad odor. And certain mouth rinsers, they have high alcohol content, which I wouldn't think is too suitable for children. Okay, so clean your teeth as much as possible. If not, if it doesn't help, look into the diet. If it still doesn't help, check with your dentist or your doctor. All right. It's a bit hard to, because there's so many causes, it's very hard to give a very individualized advice, but that's my general plan of action for all of you out there.
Thank you, Dr. David. Obviously, it will vary from case to case basis. So while we need to follow the general piece of advices, if you're still continuing to face difficulty, consulting a professional would be the ideal way to go about it. The next question that we have is from Divya, and so many others have also asked us, what is the ideal time to brush one's teeth, and if toothpaste is the only means to ensure oral care, or there are any other alternatives or better alternatives to toothpaste for that matter?
Sorry, Swati, what's the second question? The first one is the time to brush.
Yes.
And the second question?
I asked both of them, together. The first one is the ideal time to brush one's teeth, and then the alternatives to toothpaste to ensure good oral care, if there are any.
Okay. So the ideal time to brush your teeth is, the best time to brush is just before you go to bed. So you want your teeth to be clean, and when you sleep, the saliva will replenish the teeth and heal whatever things it need to heal. Okay, but you're supposed to brush twice a day. So the second time would be in the morning, or usually I advise slightly after breakfast. Okay, that's what I do. So I tend to have my breakfast and then I'll go to work and I'll brush at work. So that, remember just now in my slide, I said that it's best to, if you want to brush after a meal, it's best to brush around 30 minutes after that. So it lets your teeth harden slightly before you do the brushing. Otherwise, you can occasionally wear the teeth off, but that's not too much an issue unless you are having very acidic food all the time. Okay. I hope that answers the question. So generally at night before you sleep, or 30 minutes before, 30 minutes after the meal, and twice a day. For the type of toothpaste, okay. So I see that there's many different schools of thought on this is good because for some of my patients, they're concerned about the fluoride content. So toothpaste is just a paste. It can be mixed with anything. So most toothpaste would have fluoride, would have some form of flavoring, some form of abrasive to help to remove the debris. So you have to look into the ingredients of what you would think is ideal. Some are herbal and they don't have fluoride. Okay, I leave it up to you. Other than toothpaste itself, I think in the past people use ashes, like pumice or ash. So I think that's what my grandparents used too. Some people just use water to brush our teeth. With that said, it does depend on individual. If you have a high risk of gum disease and decay, you may really want to look for a toothpaste that's more suitable. Or if you're having sweet food all the time and you need the extra fluoride to prevent tooth decay, so you will want some fluoride in your toothpaste also. So I would think for the most personalized choice, you still have to check with your practitioner. But I would think most toothpaste in the market and like Oral 7 that I suggested, those are very acceptable for children with special needs. Okay, I hope that answers the question. So okay, maybe I'll just repeat. I'm a bit mouthful today. Toothpaste is okay. You have various variants if you don't like certain ingredients, so you can find those, buy those online. Water is fine, but you are missing out on a certain content that can help you remove the debris. You're also missing out on fluoride. You can use ash or pumice. So that's a bit abrasive. Sometimes it wears the teeth down really fast. I know there's tooth powder out there, and personally I've not used it. But if they contain a lot of abrasive, then I would advise against it for most people. Okay.
Right. Sure. The next one is actually a related question, David, Dr. David, to our previous one. This one is from Vijay Lakshmi. She's asking that her 6-year-old girl is diagnosed with Down syndrome, and she also has cavity issues. We were talking about various cleaning alternatives like toothpaste, mouthwash, and things like that. Vijay Lakshmi is asking us is there any particular brand of toothpaste or mouthwash which you would like to recommend for kids with Down syndrome who have such cavity issues?
Okay. Down syndrome is the children with Down syndrome, they are very heterogeneous. That means there's a whole range. Some are more independent, more functional. Sometimes that's what people say, and they can do well with a normal toothbrush. But if you are unsure, I think for children it's good to go with that 3-phase toothbrush. So if you talk about a tooth, there are 3 surfaces: the outer surface, biting surface, and the inner surface. So you need to have pretty good hand control in order to flip your brush in every way in the mouth, and the top and the front and everything. and that's actually a feat for children. So that that three-phase brush, it just needs them to hold it like that and go in and out, in and out. So across that, so that's can be quite helpful. But if your child, your 6-year-old child has cavities, you should get them filled, because if you have a decay and the food gets stuck there, even with very good brushing, sometimes the debris doesn't come out. So you want to get it filled and covered and prevent that decay from getting bigger and bigger. Because once it gets big, it can become painful. And it becomes painful, then that might be an extraction later on. Okay, so do seek help early.
Sure. That's the most useful piece of advice, I believe, Dr. David. And the next one is from Tanshia. I hope I'm pronouncing your name correctly, Tansha. The question is, my son, who's 13 years old, brushes his teeth, but still it looks like the kid hasn't brushed his teeth at all. Even if he brushes, sometimes it looks like he just ate something and there appears to be a layer up on the surface. Does that mean he isn't brushing his teeth properly, or is this a medical condition?
Okay, so thank you, Tanshia, for your question. Well, I haven't looked into his mouth, but it looks like when you talk about a layer up on the surface, it might be some calculus, but I can't be sure. It might be beneficial to see a dentist first. So if it's tartar or calculus, which is the hard deposits over the teeth, you will have to get it professionally cleaned off before you can do really good brushing. Okay, aside from that, for children especially, and for children with special needs, it's hard to brush. That there will be a spectrum where they can do a bit of brushing but not very well, and all the way to perfect brushing. So there's a whole spectrum, and some of them do it well on one side and poorer on the other side. Some of them cover the outer surface but not the inner surface, and some of them do it the other way around. So I would advise caregivers, so you can try this technique called chaining. So you start off you could start off in any way. You can do a bit of brushing for the child, and you get him or her to hold the toothbrush, and you grab his or her hand and you do the brushing and over all the surface, and then you let him or her go and try to do it him or herself. Okay, so as you progress, maybe the next week you can try a variation. You can let him or her start brushing first, and you look at it, you see where is which areas are being missed. Then you guide his hand or her hand. When you are guiding the hand, sometimes there can be resistance. So there should be a last step where you take over the brush and you do that brushing for him or her. So you can chaining forward and backwards chaining. So this concept of chaining comes from occupational therapists, which I got quite a lot of help from my multidisciplinary friends on how to bring about all this brushing, all these oral care behaviors. I hope that's helpful. Please try it out and let me know how it is. All right.
Great. Hope that would help, Tansha. The next one, while we are talking about cleaning the teeth, the next one is from Hema, which is also seems to be a related question. Hema says her 17 years old child with ASD is not showing and also not brushing inside of his teeth on both the sides. And he has got so much of plaque in front and also on his side teeth. When we took him to the dentist, he did not open the mouth and did not cooperate. The dentist said that we need to give anesthesia or take him to a different hospital. But the child is not cooperating to go to another hospital because he has transitional issues and severe anger or meltdowns. So when the parents tried to take the son to a different hospital, he started hitting or breaking things, which the parents were not able to manage. Now, the parents' question is how to remove this long time plaque buildup, which has become very hard to remove now, and more so when the child is not cooperating.
Okay, thank you so much for your question, Hima. I see that I'm sorry that you're undergoing so much difficulties to get the teeth of your son sorted out. When you tell me about this, I think this is you might have to seek a special care dentist in your country to work out the ways to get this done. So there are some ways to bring them to a different facility if it's very, very difficult. Firstly, behavioral wise, you can, if it's possible and time permits, bring them down a few times, not to see the dentist, but just to get acquainted with the environment. And I've done this a few times. So I do graded exposure. So we do a video of the area, we show the video, show the dental office, the face of that dentist, and we bring the person in one time, twice, and then before we see him or her on the chair. Of course, there will be instances where it's very, very difficult for the person, and they may need to be sedated before to travel down to the hospital, but that's really rare. So far in my experience, there's only been one like this. Okay, so getting acquainted, familiarity is something that I think works very well for patients with autism spectrum disorder. And once they pass that familiarity, that hurdle, right, they do become very acceptable. They accept dental treatment quite well. Some of them routinely accept injections, and they don't even blink because it's just so routine for them. They know what to expect, and there's not too much differences. So I think I'm not very sure which country you are from, but looking at the majority of our participants, if you're from India, there's this Federation of Special Care Dentistry. You might want to drop them an email to see if they can refer you a special care dentist. Because if your son is 17 years old, usually the children's dentist would not want to see them. So you will want to see an adult dentist who is familiar with special needs adults. So that would be special care dentist. So if you're in India, that's Federation of Special Care Dentistry. All right, you can go to Google search and can ask them some questions. All right.
Thanks a lot, Dr. David. I'm really hopeful that this would help Hema. And yes, looks like that she's from India. So hope that helps you, Hema. The next one is from Gausalya. Gausalya is asking us, what is the right age of taking children for an oral checkup, and how often should one take the child for oral checkups?
Okay, so thank you for your question. I think it differs, according to dentists, it differs. So sometimes they say, some dentists say 3 years old, but for me, if I'm specifically looking at children with special needs, I would say once the teeth starts coming out, get them to see the dentist early. The issue is sometimes children with special needs also have developmental disorders and various medical conditions which can cause them to have teeth issues, fused teeth, lesser teeth, or malformed teeth, or teeth that's lacking in certain minerals and the structural breakdown. So good to just have them start them off early seeing the dentist. You may not need any treatment, or maybe you just check with the dentist what's a good way to brush and how do you do it. Yeah, so it's to start you off on the whole oral health prevention, starting on good habits. Okay, I hope that answers the question.
Surely it does. Okay, the next one is from Rajeshwari. Rajeshwari is asking us, is it advisable to use a vibrating toothbrush to take care of oral health of a child who's autistic at the age of 18 years?
Okay, very good question. Vibrating toothbrush or mechanical toothbrush. So I believe many of you will have seen advertisements, ads about different types of mechanisms of mechanical toothbrush. Some are rotating, some are vibrating. They come in all different types of shape and sizes. my key to a good toothbrush is that it should be able to cover all parts of the mouth. Okay, so whether you are using a manual toothbrush, you have to cover that area. If you're using the vibrating one, it helps you to brush a little, but if you don't cover that area, you don't put the brush in the correct area, it's not going to brush that area. So for me, most brushes work as long as you do the techniques correctly. As for the child with autism spectrum disorder, well, I think they like routine. So vibrating, some of them do enjoy the vibrating and the mechanical sound and the sensation. And if they like it, then I think don't change it, keep to it. You tend to be able to brush a bit quicker with that, with the mechanical brush, because it just turns and do things a bit faster. But if you find some of this toothbrush too huge, especially because if you need that mechanism inside the tip of the brush and you cannot reach some of the upper back teeth, then you might want to consider changing to a manual toothbrush, because manual toothbrush tend to be slimmer. And like you said, 17 years old, if they are going towards 20, you will start to have issues of wisdom teeth. I tend to find growing wisdom teeth, it's harder to reach these areas with a mechanical toothbrush. So you will want to look at the size and ensure that it can reach that area. All right?
Sure. Thank you, Dr. David. Hope that helps the one who has asked the question, and also so many others. The next one is from Sumita. Sumita is watching us live from Zoom. And Sumita is asking us, what type of food generally causes gum disease, and what type of food in particular should we avoid to avoid gum disease?
Okay, this is a very good question. What diet causes gum disease? To be honest, I think scientists haven't found any very concrete evidence, so I cannot give you a very direct answer as to this. I would say that gum disease generally occurs when there's a prolonged period where you don't clean your teeth that well. So there's soft debris, soft deposits of plaque. They are the similar terms. So if there's build-up of this, and if they harden, they become hard deposits. So they can call them tartar calculus. So once you have this, the bacteria gathers there. They start to cause the gum to become inflamed. Okay, so that's one way you get gum disease. The other way is when you have medical issues, diabetes, and it causes gum inflammation, and that causes your teeth to become shaky. And even with very good dental treatment, sometimes these gums don't heal, because the gums are, the health of the gums is tied to your innate health, your physical health. So if you talk about how diet affects gum disease directly, it's not so direct. But if you talk about wanting to prevent chronic disease, you want to prevent diabetes, hence that in that way you improve oral health, then yes, I would say follow the healthy diet, fruits, vegetables, less sweets, less processed foods and stuff like that. Okay?
Right. Healthy diet is the healthy diet for your oral health also. A valuable lesson that we learned from Dr. David today. Since we are running short of time, Dr. David, I will take one last question for today, which is from Maria, who's also watching us live from Zoom. Maria's question is, what do we do when the permanent tooth is coming out, but the milk tooth is not yet moving for a 7-year-old kid?
So the question is, the permanent tooth is coming out
at the
but
same
the
place.
baby, okay.
Yeah. But the milk tooth is not yet moving.
Okay. Generally, when this happens, I would usually advise the parents to wait for about 6 months. If you want to proceed on with to extract the baby teeth, it's possible, but I don't see a lot of added benefit. especially if the area is clean. If you do get food stuck around the area, then I think that's a sign that I would want to remove the baby teeth. But generally, especially for the lower teeth, the adult teeth will slowly creep up behind the baby teeth, and then it will sort of push it out. So you will have a point where you sort of see the adult teeth on the inside and the baby teeth starting to come out. So unless there's a need for the teeth to come out, I will tend to let things happen as it is.
Let time do its part. A very interesting, Dr. David. I'm pretty sure people have learned a lot from you today. And as I was going through the chat box, there were requests for holding a, part 2 of this session. Today's session was that informative for them. And of course, there are words of gratitude from all the attendees. So thank you so much for sharing your knowledge and expertise from all the years of experience that you have. We're really grateful.
Thank you all so much for your time and listening to me. And I hope that all of you will be able to find this helpful for your child. Okay?
Surely. Before we end the session, I would like to remind our attendees that the certificate training program for managing special needs in mainstream schools is starting from 2nd of September. The first workshop would be conducted by Miss Rita from US. If you haven't yet registered for the workshop, please find the link in the chat box. And in the same module, there would be another workshop getting conducted on 9th of September. If you haven't yet registered for that also, please do find the link in the chat box. Do register for the workshops. Some interesting stuff is coming your way. A lot of effort has gone into making of this program. Please show up, and I hope you would like the experience of attending all the sessions, just like today. Thank you so much, Dr. David. Once again, your final words about today's experience of conducting this session.
Thank you all for your kind words and your encouragement. I think oral health and oral care is something that's very important. And if we can improve this part, and it will really help our children with special needs to really pursue the things in life with a healthy mouth. Okay?
Totally. Thank you so much. And dear participants, do not forget to share your feedback. Your feedback helps us improve the experience further for you all. So do share your feedback about today's session. And that brings us to the end of today's session. We'll see you on the next ability session. Thank you so much, Dr. David.
Thank you all.